Hello everybody, and today we'll be talking about cardiac cycle and electrocardiogram or ECG. Now, cardiac cycle is defined as the succession of coordinated events taking place in the heart during each beat. Each heartbeat consists of two major periods called systole and diastole. During systole, the heart contracts and pumps the blood through the arteries. During diastole, the heart relaxes and blood is filled in the heart. All these events are repeated in a cyclic manner. The various events taking place in the cardiac cycle are broadly divided into atrial events and ventricular events. Atrial events takes place in the atrium and ventricular events takes place in the ventricle. Now, when the heart beats at a normal rate of 72 beats per minute during of each cardiac cycle is about 0.8 seconds. The atrial events are further divided into atrial systole, which lasts for 0.1 second, and atrial diastole, which lasts for 0.7 seconds. Whereas ventricular events are further divided into ventricular systole, which is for 0.3 seconds, and ventricular diastole, which is for 0.5 seconds. So in clinical terms, systole means ventricular systole and diastole means ventricular diastole. So the cardiac cycle is a series of events in which contraction and relaxation of the ventricles takes place mainly. Now coming to the atrial systole, this is also known as rapid filling phase or pre-systole. It is usually considered as the last phase of ventricular diastole. The duration is 0.11 seconds, and during this period, only a small amount, that is 10% of the blood, is forced from atria into ventricle. The intra-atrial pressure increases, intraventricular pressure and ventricular volume also increases, but slightly, because only 10% of the blood is allowed to flow into the ventricles, right? So the ventricular pressure is less. Now, fourth heart sound is heard during the contraction of atrial musculature. This is the first heart sound heard during the cardiac cycle. Now moving on, the next step is atrial diastole. Contraction has happened, now relaxation has to happen. Now, atrial diastole starts after atrial systole. Simultaneously, ventricular systole also starts. Atrial diastole lasts for 0.7 seconds, and the long atrial diastole is necessary because this is the period during which atrial filling takes place. Like in the last stage, you saw that time period was also less. It was just 0.1 seconds, whereas here it is 0.7 seconds, and more blood is allowed to be filled into the atrium. As you can see, the blood is getting filled into the atrium in the picture. Okay. Now, next is ventricular events. The various ventricular events are isometric contraction period, ejection period, protodiastole, isometric relaxation period, rapid filling phase, slow filling phase, and last rapid filling phase. Starting with isometric contraction period, it is the first phase of ventricular systole and it lasts for 0.05 seconds. This is a type of muscular contraction characterized by increase in tension without any change in the length of muscle fibers. Immediately after atrial systole, the atrioventricular valves are closed due to increase in ventricular pressure. Semilunar valves are already closed. Now, ventricles contract as closed cavity because all the valves are closed. Atrioventricular valves are also called as tricuspid valves. Now, in such a way, there is no change in the volume of ventricular chambers or in the length of the muscle fibers. Only the tension increases in ventricular musculature. Now, we hear the second sound, that is the first heart sound. I mean, in sequence, this is the second sound that we hear, but it is called as first heart sound, which is heard at the closure of atrioventricular valves at the beginning of this phase. Ejection period is the next step and in which, due to the opening of the semilunar valves and isotonic contraction of ventricles, blood is ejected out of both the ventricles. Now, blood is going to be out of the ventricles. Hence, it is called as ejection period and the duration is 0.22 seconds. Ejection period is of two steps. First is rapid ejection period, second is slow ejection period. In the rapid ejection period, immediately after the opening of the semilunar valves, the blood starts getting ejected off both the ventricles. This lasts for 0.13 seconds. Now the semilunar valves are being marked in this picture closely. Now moving on to the second stage, which is the slow ejection period. During this stage, the blood is ejected slowly with much less force and the duration of this period is 0.09 seconds. The next stage is protodiastole. It is the first stage of ventricular diastole, hence the name protodiastole. Duration of this period is 0.04 seconds and due to the ejection of blood, the pressure in aorta and pulmonary artery increases and pressure in ventricle stops, or I should say it drops. Now when intraventricular pressure becomes less than the pressure in aorta and pulmonary artery, the semilunar valves close. At this stage, we hear the second heart sound when during the closure of semilunar valves during this phase produces the second heart sound. Now next phase is isometric relaxation period. It is a type of muscular relaxation characterized by decrease in tension without any change in the length of muscle fibers. During this period, once all the valves of the heart are closed again and intraventricular pressure decreases, duration of this phase is 0.08 seconds. Next phase is rapid filling phase. It is seen when atrioventricular valves are opened. There is sudden rush of blood from atria into ventricles. So this period is called as first rapid filling period. Ventricles also relax isotonically and about 70% of the filling takes place during this phase, which lasts for 0.1 second. Now the third heart sound is heard, in which rushing of blood into the ventricles takes place. Next phase is slow filling phase, and after this sudden rush of blood, the ventricular filling becomes slow. Now it is called as slow filling phase, which is also called as diastasis. About 20% of the filling occurs in this phase and the duration of this phase is 0.19 seconds. Now the last is the last rapid filling phase, and this occurs because of atrial systole. After slow filling period, the atria contract and push a small amount of blood into the ventricles. About 10% of the ventricular filling takes place during this period and flow of additional amount of blood into the ventricles occurs due to atrial systole and is called as atrial kick. Now after studying about various events in the cardiac cycle, let us study about the electrocardiogram. The continuous movement of the heart generate electrical signals that can be measured by placing electrodes at specific points of the skin from which a recording is produced in the form of a graph which is called as electrocardiogram. This entire test is called as electrocardiogram. Now there are certain points on the electrocardiogram. The first one is right atria contracts, produces action potential, signal from the SA node. Now signal spread across both the atria causing muscle cells to depolarize means negative charge will change to positive charge and contraction takes place in the atrial systole. This depolarization of atria is shown as P in the ECG. Now after the P point, there is a flat line of PR. What is this PR? It is a flat line because the signal is leaving the atria and entering into the ventricles. Okay. The next is rapid contraction of the ventricles takes place, which is depicted by QRS. This is also called as ventricular systole, and this causes rapid ventricular depolarization. After ventricular depolarization, there will be ventricular relaxation, which is also called as repolarization of the ventricles. And this is depicted by T waves. The ST segment is the time taken for both depolarization and repolarization. I hope you enjoyed the session. Thank you so much.